Hello out there in television land, and I'm not sure where this television land came from. I think it goes back to the 60s when they used to say that a lot. But welcome out there in television land to another edition of It's Your Health. Philip Benyo with my bride, and bringing you the latest and greatest in healthcare information. Right, sweetheart?
Right.
Isn't she a perfect wife? She just agrees with me. We'll be right back after this brief commercial message. Make sure you check with your healthcare provider before doing any of the things that we talk about here on It's Your Health. We'll be right back after this brief commercial message.
Welcome to the first part of It's Your Health. And I'm going to ask you, do you know what that's a picture of?
I've not seen that in my medical books, no.
It's not a woolly mammoth.
I see.
It's a woolly caterpillar.
And
do you know anything about that?
It doesn't look like the usual ones I've seen.
Well, usually they're reddish, have some orange, maybe a stripe of black, but this one's all black. And lore, or the belief of people, is the blacker the fur on the caterpillar is, the worse the winter is going to be.
Oh, that portends badness.
Yeah, so if you go by that, and if you go by the caterpillar, it's going to be a tough winter. But who knows?
Well, it was a quick summer, I can tell you that.
What summer?
That's true. It was kind of wet, if you will. And in extrapolating that, it might be a wet winter. So I don't know how we got onto that topic, but this is It's Your Health.
Well, that has to do with your health.
And we can start with some headlines, I suppose.
This is a big headline, a long headline. Cardiovascular disease risk and statin use among adults with metabolic dysfunction associated fatty liver disease. Increasing prevalence of obesity and metabolic disease over recent decades has contributed to a significant burden of fatty liver disease and associated cardiovascular disease. Now, you can explain that in English.
Right. Well, we do see more cases of what's called fatty liver. Usually when we do an ultrasound, we read a report that says there's some fat infiltration in the liver. And ordinarily we would say, well, lose some weight and cut down on your fat intake. But when it's associated with diabetes, obesity, and chemistry abnormalities, we would generally like to involve a statin use with this particular illness. And it turns out that that's the current recommendation.
Remind us what a statin is.
Statin is a cholesterol-lowering medication because it's the fat, so we want to try to reduce the fat intake itself. So when we see fatty liver associated with other metabolic issues, hypertension, diabetes, obesity, they should be treated with statins, cholesterol-lowering medications.
Gotcha. This one's not as hard. Physical activity, sedentary behavior, and risk of COVID. Higher levels of pre-pandemic physical activity were associated with a lower risk for COVID.
Well, exercise, exercise, exercise. It's a mantra here on It's Your Health. And it turns out that if you are going to get COVID and it's making a comeback, I'm sorry, that you're probably going to have less severity of disease if you're someone who's a little bit more physical and fit.
And as I told you, just on CNN today, they had an article about COVID coming back.
Can we mention other television networks that we're competing with?
I don't think we compete with them, do we?
They compete with us.
They don't have a chance with us.
Okay, very good. They don't have you.
They don't have us. Okay, now we're going to talk about young girls and women are at high risk of iron deficiency. Nearly 40% of girls and women in the United States may have iron deficiency, which can lead to fatigue and increase the risk of many health problems. Some of the symptoms are pale skin, cold hands and feet, feeling dizzy or lightheaded, and get this, unusual craving for non-food items such as ice, dirt, or paper.
Yeah, we do see that a lot. That type of behavior in iron deficient anemias, they crave ice for some reason. But of course, women who are having their monthly cycle are going to be losing blood, and it's very subtle. But if you are having symptoms, get your complete blood count, CBC, checked along with an iron level, and hopefully that'll get corrected.
If you don't have symptoms, should you get your iron checked anyway?
I think at some point in your life you should get a complete blood count, yes. And you know, when you're an adolescent, you don't think of these things, but it's part of perhaps a annual physical.
Okay. What if some parents came to you and said that their child, their young child, wants to play football, and the father says he should and the mother says he shouldn't?
Tough call. There are pros and cons, like in anything else. Playing football is a physical activity. It has some social mingling, if you will, some maturity. And so one could say, well, it's, you know, part of a rite of passage of being an adolescent and a teenager. The other side of the coin is we are seeing with repeated small head traumas this brain injury that can occur years later. We of course see that in the people who play perhaps a more intensity of football, like the college or the pros. But keep in mind that your brain is sitting in almost like an aquarium full of water. And if you shook an aquarium, guess what? The brain's going to hit the side of your skull, and this can cause damage. So I think you need to avoid head trauma at any age, all the time.
Okay, it says here, there are numerous benefits of regular exercise and participation in sports. Physical well-being, health-related and general quality of life, body composition, cardiorespiratory endurance, strength, self-esteem, learning and memory, sleep quality, neurogenesis and life expectancy, decreased risk of anxiety, depression, cigarette smoking, illegal drug use, carrying a weapon, attempting suicide, cardiovascular disease, hypertension, type 2 diabetes, and death from any cause if they play football.
Oh, well, I don't know. In my books, I would probably get into some other type of sport where there's less potential for head-to-head contact, if you will.
It also says the earlier in life a child participates in football, the higher the risk of things going wrong. They will have difficulties with their cognitive, behavioral, and mood symptoms. And repeated head impacts during a critical neurodevelopmental period, 10, 11, 12, 13, 14, may increase the risk of later cognitive development. So,
you know, I'm always looking forward to football season, and that kind of puts a little bit of a damper on things, sweetheart.
oh, not really. You
Okay.
can't wait for the next game.
That's true.
Okay. You'll have to talk about this, but I'll start it off.
Go ahead.
Transform how you treat diabetes with the all-new Dexcom G7.
This is revolutionary. You know, we have to check your blood sugar and do finger pricks, which can add up to pain and suffering, if you will. However, these new machines, you put a patch on your arm and you can read your blood sugar through the phone or with a monitor. Everyone should look into it, check your screen and go on the website and see if your insurance will pay for it. It's a godsend.
My mother would have loved that.
No doubt. And as fate would have it, our first segment is coming to a quick close.
Oh boy.
I know. I guess there's someone who's just been doing too much of this. I don't know. I could be wrong. But we'll be right back after.
Hold yourself back then.
Okay. We'll be right back after this brief commercial message. Do us a favor. Call our sponsors and tell them you heard it on It's Your Health, and more importantly, try to utilize their services. We'll be right back. Welcome back to the second segment of It's Your Health, the fastest 30 minutes in television history. CNN can't say that, but go right ahead, sweetheart.
Well, I'm glad that you're not a golfer. Because here the guy is saying he just got a set of golf clubs for his wife. And his friend said, I wish I could have gotten the golf clubs instead of my wife.
There you go.
Yeah.
Sounds like a deal, huh?
Oh boy, what a deal. This next one, I don't know many people who do this, but the people who do, it drives me crazy. Cracking your knuckles and arthritis, what you need to know. Cracking knuckles is a regular habit for many people. Misconceptions about how the action works may cause people to believe that knuckle cracking causes damage that can lead to arthritis.
Yeah, our knuckles were not meant to be cracked. No joint really is, quite honestly. So cracking knuckles will probably not lead to anything bad, but it could. And so you just shouldn't do it.
Well, it can lead to finger dislocation, sprained ligaments, reduced grip strength, injury to the joints, hand swelling, and I'm talking too much again, right?
I didn't say anything.
But don't crack joints such as your neck or back, because that definitely could lead to an injury.
Right, leave that to a specialist.
Absolutely. I like this next one. 3 ways tea makes menopause easier. Menopause can seem like a losing battle, but what if feeling like yourself again was as easy as pouring yourself a cup of warm tea? Green tea's antioxidants relieve inflammation and stress, improve memory and cognition, keep your bones healthy and strong, and boost metabolism. But better than that is matcha, which is green tea grown in the shade that is powdered, and it has 10 times as many antioxidants as regular green tea. And the third kind of tea is red clover. I never heard of that before, but it helps the body balance estrogen, which cuts down on night sweats and hot flashes.
I'm all for that.
Can you believe that?
Yeah.
Just drinking tea, but they do tell you, skip the coffee. Coffee is not your friend when you're going through menopause.
Does this work for male menopause too, or just female menopause?
You have menopause?
I've gone through it. You'd experience it, didn't you?
You've gone through it with me, is how you've gone through
okay.
it.
Hand in hand.
Yeah, that's for sure. Okay. Management of low back pain guidelines. Low back pain is one of the most frequently experienced medical conditions, affecting 84% of adults in this country. They will have experienced this type of pain, and it's the leading cause of disability worldwide.
Well, yeah, it's very common, and part of the problem is there are other serious conditions that can manifest themselves as back pain. So what we call red flags, things that are serious that require emergency treatment. For example, saddle anesthesia. What does that mean? Well, think of your rear end as sitting on a saddle of a horse, and if that area is numb, that's a big problem. That's a red flag. You've got to go to the emergency room immediately. If you're having trouble with passing your water, having trouble with your bowels associated with back pain, that's a problem. You need to get emergency treatment. So most of the back pains are mechanically a problem in terms of being a weekend warrior and doing something silly that you shouldn't have done or don't do very often. And that tends to resolve itself with time. Some rest, some heat, maybe seeing a chiropractor. I'm not a favor of analgesics, but given enough time.
Tell us what analgesics are.
Pain medications, per se. Usually back pain kind of resolves itself. However, one of the things that we're going to talk about next is what?
Lumbar disc herniation, diagnosis and management.
Well, this is a little bit more of a problem. I want you to look at this picture of the lumbar spine, which is normal. And you'll see there's nerves coming out on both sides that power your legs, for example. And look at this second slide where it shows a herniated disc. Think of it as a jelly donut, and some of the jelly is coming out of the donut. And guess what it's doing? It's pinching the nerve. The outside of the nerve carries sensory fibers, so it causes pain. And herniated discs are generally diagnosed with an MRI. An ordinary X-ray won't help. And the treatment is somewhat I can't say complicated, but it can be involved because how you get the jelly back in the donut, it's pretty hard. Some people require shots to the area, rarely surgery, but if you're having pain that doesn't go away and it's not one of these red flags, you seek some further care and treatment. I don't know if there's anything else.
You said it all. I don't need to add anything.
What? Pinch me, pinch me.
Oh, don't tempt me.
Okay, go ahead.
The best foods to strengthen bones and boost bone healing for women. Foods can literally be a make or break factor in the body's ability to replenish important bone building nutrients.
All right, there's the list. You can look at them and see at the grocery store.
Are we going to talk about them or we're just going to show them?
We'll probably just show them.
Okay. I do want to talk about wild-caught salmon.
Okay.
I tell you and tell him that's the kind of salmon you should buy. You should not buy the salmon that's made in a...
It says wild caught from Alaskan waters.
Oh, really?
Yes.
Oh, so you're buying it. That's wonderful.
Right. Yeah, I am.
He and Donnie like it.
It is delightful, I have to say.
Okay, as we're talking about things to eat, we have some superfoods here.
Again, look at the list. I kind of like all these things. I don't think I make oatmeal for you, but everything else on that list we have.
Yeah, but I don't like leafy greens as kale, collards, spinach, mustard greens, and Swiss chard. I wouldn't pick that out.
I agree with you there.
But everything else, garbanzo beans, ooh, I love those. And they tell you to buy the ones that say no salt added.
Yeah, hard to do. A lot of hidden sodium in some of those canned things. Listen, talking about canned things, we're going to be right back after this brief
We're
commercial.
not finished already.
Yes, we are, sweetheart. Time goes fast. And we'll be right back after this brief commercial message. Remember, you're watching It's Your Health. We're your leader in healthcare information, not CNN.
No. Welcome back, and I'm glad to say that our golden doodle Donnie has not eaten anything off the refrigerator. You can see he's eaten all the magnets, so now he's attached to the refrigerator.
God bless him.
So that's one thing we don't have to worry about. So instead, we'll go into headlines. Emergency care visits after cannabis, that means marijuana use, rising among older adults. Cannabis can slow reaction time and impair attention, leading to injuries such as falls, psychosis, delirium, paranoia. I can't even say it. It worsens cardiovascular and lung disease, and it can interact with your prescription drugs. So it's not a good choice.
You know, we had such a high threshold before, at least when I was growing up and younger, and I'm kind of old school where, you know, marijuana was just a dangerous drug and it was illegal. And it seems like we've kind of lowered the bar and now, well, anything goes kind of mentality.
Well, also, from what I read, I won't say where, the marijuana is different than it was 50 years ago.
Yeah, it could be stronger,
So,
you're right.
yes, so it's much stronger and you don't know really what you're getting. So, junk food addiction more common in women. Nearly 1 in 5 older women showed signs of addiction to highly processed foods and drinks, much more so than men, especially women in the 50 to 64-year range. They were overweight, or their physical or mental health was fair or poor. Highly processed foods, I thought this was interesting, release a dopamine surge in the brain's reward system, leading to addiction.
Well, dopamine, of course, is that feel-good chemical that gets released when we do things that make you feel good. And, you know, going to a fast food place and getting some of these foods, it's quick, it's economical, and you get rewarded by higher dopamine levels. So, yeah, it's a vicious circle.
But it's short-lived, isn't it, the dopamine level?
Right, which is why you end up
Being
going back.
addicted.
Right, exactly.
Gotcha. Okay. I'm learning about this. Sleep apnea may lead to weaker bones. People with sleep apnea are more likely to have low bone density. It can trigger low oxygen levels and inflammation, which interfere with the continual cycle of bone breakdown and renewal. Lower bone density levels increase the risk of broken bones and causes teeth to become loose. And screening tests for bone density, we talk about this all the time. Every woman 65 and older should have the bone density test.
Right, you're talking about two diagnoses which are silent and cause no symptoms, so not too many people think about them. They don't come in our office with a sticker on their head saying, check me for sleep apnea, which is extremely common, or check me for osteoporosis, which is extremely common. And don't forget, men get osteoporosis as well. And it can be made worse if you're sedentary, on steroids, certain medications like proton pump inhibitors that we're all on for too much acid reflux. So DEXA imaging scanning and home sleep studies to diagnose sleep apnea. Two things which you need to look into.
I don't know too much about the sleep apnea, but the DEXA imaging is easy and fast.
And the home sleep study, you pick up a box, it has a pulse oximetry on it, which will record your oxygen levels, and they'll record them while you're going through the periods of sleep. And our oxygen levels should be at least 94% or more. Some people go into the 80s. And I ask patients, how long could you hold your breath? And they say, oh, maybe 20 seconds. Well, guess what? You may actually spend more than that with an oxygen level in the 80s.
So you can do this without having to go somewhere?
Correct.
Oh, well, that's really good.
Yep, very convenient.
Okay, here's something that's not as much fun. Chronic constipation. Constipation lasting at least 3 months in the absence of a malignancy or an obstruction is considered chronic constipation. So what do you take? What do you do?
Well, first, it's a diagnosis of exclusion. We need to make sure that you are having enough fiber, that you are hydrating yourself, that it's not medicine-induced. If you're on chronic pain medications, you have to go through a series of tests to make sure you don't have something bad. And at the end, if you have chronic constipation, there are wonderful medications out there that would relieve it. The list is a little bit too long to go over, but we have them in our armamentarium, so no one out there should be suffering with
Are
chronic
they all
constipation.
prescription medications, or are some over the counter?
Some are over the counter. You can get stool softeners like Colace or a laxative vegetable one like Senna. Those aren't prescription medicines, but some of the others are. Like Linzests, like lactulose, which is a non-absorbable sugar. And again, the list goes on and on, and we try to match you with the right medication, and usually we can get a match.
Well, that's great. That's a problem if you can't go to the bathroom.
You know, there was once a joke that was out there that the body parts were arguing with each other, who's more important? And the brain says, I'm the most important. And the heart says, no, I'm the most important. And the rectum says, no, I'm the most important. And here they said, well, prove it. Well, the rectum went on strike. And within 3 days, the rest of the body parts said, all right, we've had enough. You won.
They're not working. Okay. Speaking of not working, 21st century healthcare challenges in our country. The first one is either none or inadequate health insurance. many Americans find themselves with no or inadequate health insurance. What I thought was especially important is that people who need assistance but don't have any medical health care, the cost of their care is borne by charities. Increased hospital charges to people with insurance, and local, state, and federal taxation increases. So we're paying for it one way or another.
And it's just insane that this is a highly industrialized country who can provide the best health care, and for some reason we're falling short. And it's embarrassing when we prescribe medications and it's not covered. It's just, we're going in the wrong direction.
Well, the second one is low scientific and health education. There's poor health choices, and proof of that is failure to accept vaccination for the COVID.
Enough said.
Okay. And the third one is prevention and management of chronic disease with premature mortality and disability. Chronic illnesses are costly to society, and most are preventable, especially diabetes, obesity, cancer, and the list goes on, heart failure, stroke. Action to increase the number of primary care physicians is at a crisis.
Yep, we are at a crisis, and part of the crisis is the end of this television program right now.
I'm not finished.
Well, CNN has an opening. Maybe you can go there.
Okay.
Thank you for joining us and allowing us to come into your home to inform and hopefully entertain you. Remember, you heard it best on It's Your Health, right, sweetheart?
Yes, on It's Your Health.
Okay. Take care. Be safe.